very important question that has been continuously repeated for different GCC exams. Okay, as we can read over here, a nurse is assigned to care for a 8-year-old child with a diagnosis of basilar skull fracture, like ecchymosis, right? Ecchymosis over the or behind the ears. So we have seen what is basilar skull fracture. What would be the manifestations? Okay, so actually, hi all, welcome to Eduooz International Academy. So today we are going to discuss one very important question that has been continuously repeated for different GCC exams. Okay, so let me discuss the question first. Okay, so as we can read over here, a nurse is assigned to care for a 8-year-old child with a diagnosis of basilar skull fracture. The nurse reviews the pediatrician's prescription and would contact the pediatrician to question which prescription. Okay, so let us discuss the question. The child is 8 years old and the child is having what? Basilar skull fracture. Okay, so actually for the children or the patients with basilar skull fracture, actually there are some interventions are there that that are not actually supposed to do for that patient. Okay, why? Because it will lead to different complications that we will discuss. Okay, so let me discuss the options. First option is obtain daily weight. Option B, provide clear liquid intake. Option C, nasotracheal suction as needed. Option D, maintain a patent intravenous line. Okay, so what can be the answer over here? Okay, we'll see. Okay, so first we will discuss what is basilar skull fracture. Okay, so the basilar skull fracture means the patient will have sort of fracture in the base of the skull. Okay, so this is a skull and maybe the patient will have sort of fracture over here or any areas over the base of the skull. Okay, so that is what is termed as basilar skull fracture. So next question is how you can identify the patients with basilar skull fracture. Anyway, if they're having basilar skull fracture, the secretions, especially the CSF, right? CSF. So CSF will drain through any of the like ports, like maybe it can drain out through the nose, we'll call it as rhinorrhea, or otherwise it can drain out through the ears, we'll call it as otorrhea, right? Okay, so if the patient is having like a basilar skull fracture and if the patient is exhibiting any of these things, what it will mean? It will mean the patient is having some sort of injury in the basilar area of the skull, right? Okay, so otherwise the patient will have ecchymosis, right? Ecchymosis over the or behind the ears, we'll call it as what we'll call it as battle sign, right? Battle sign. So what is battle sign? Battle sign means like the patient will have ecchymosis behind the ear, that is what it's called as, or post auricular ecchymosis, that we'll call it as a battle sign. Otherwise the patient will have sort of appearance over the eye similar to raccoon. Okay, we'll call it as raccoon eye, that is actually periorbital edema as well as ecchymosis. Okay, so if the patient is having periorbital edema as well as ecchymosis, we'll call it as what? Raccoon eye. Okay, raccoon eye. So these all are basically the clinical manifestations or symptoms of patients with basilar skull fracture. Okay, so whenever you are getting a patient with any complaints or any history of basilar skull fracture, you can see these all like clinical manifestations. Okay, so then next, another very important question that is most frequently been asked for exams is like if the patient is having sort of discharge from the nose or ears and all, like how you will identify whether that fluid is blood or CSF or any other fluid. Okay, so for that actually we can do one test which is called as like halogen. Okay, it will give halogen. What is halogen basically? So whatever fluid that is draining from the nose, from the ears, that actually we have to collect in a gauze piece. Okay, in a sterile gauze piece we have to collect, and after some time it will give the appearance similar to this, that is actually blood which has been surrounded by one yellow halo. Okay, so that is actually called as what? Halogen. So come back to our question. Okay, come back to our question. Okay, so basically what can be? So we have seen what is basilar skull fracture. What would be the manifestations? Okay, so actually here in the question, so for this regarding this pediatrician's prescription, like which prescription would the nurse question? So what can be the answer? See, suppose the patient is having sort of like a secretions that is coming through the nose. Okay, so maybe we will do some sort of suctioning and all. So we will think that it will save the patient, will like suction out the secretions. Okay, so what it will lead to? It will lead to massive hemorrhage. Okay, so actually if the patient is having, of if a patient is suspected of having basilar skull fracture, you are not supposed to do what? This option C, right? That is, you are not supposed to do nasotracheal suction. Okay, so you have to question this order, and this would be the answer over here. Okay, so like this, actually we are having numerous questions in our question banks, and also our basically our GCC course is designed in such a way that we will be actually highly focusing on the high yield areas, repeating areas. So this we'll discuss in detail so that you will get an idea, and you will be able to pass the exams in first chance itself. Okay, so let me invite all of you to our classes, and you can secure your dream job in abroad. Okay, thank you.